Africa is set to acquire vaccines through a number of initiatives. The global COVAX facility has secured close to 600 million doses for the continent.
The vaccines will then be distributed to those countries that have applied, and the country itself makes a prioritization: who will get the vaccine first, how much vaccine will be given, which parts of the country will get it.
COVAX is led by the World Health Organization and the Gavi Vaccine Alliance. The initiative aims to equitably distribute COVID-19 vaccines across the world.
So COVAX provides for 20% of the population.
Surely 20% is limiting when you look at the population of most African countries.
The problem is that there's not that much vaccine availability, and the main interest that WHO has is that there's equity, that all people, all countries of the world actually have access to some vaccine. The problem is if one country takes all the vaccines, then the other country will get no vaccine.
Countries have been placed into two groups depending on their financial strength.
So the first group, actually, they will be provided with donations, the vaccine, including Kenya. The COVAX facility will be a donation. Other countries that have got more financial means can also apply for that vaccine, but then on own cost. They will have to procure it themselves.
With variants that are even more contagious emerging, the race to acquire the now precious COVID-19 vaccines is on.
So I think almost all countries have applied. I don't have the exact figures, but almost all African countries have applied that are eligible.
The African Union has also secured 270 million vaccines doses for distribution across the continent. But it is not just the purchase of vaccines that poses a challenge for Africa. There is also the challenge of transporting some vaccines, like the Pfizer vaccine, that must be kept at the extremely low temperature of negative 70 degrees Celsius. Dr. Eggers, however, says there are other options for Africa. The Oxford AstraZeneca vaccine can be kept at standard refrigerator temperatures of 2 to 8 degrees Celsius.
Most of the COVAX countries actually prefer the more regular vaccines, the vaccines that can fit into the regular fridges and the regular cold chain, because all countries have got a cold chain. They're running their normal vaccine programs. I don't have a doubt that a country such as Kenya will be able to distribute the vaccines. I mean, we give vaccines every day to children all the time, so the ability to do that is there.
In the meantime, Dr. Eggers is encouraging African governments to try and acquire more vaccines for their people. Enoch Sikolia, CGTN, Nairobi, Kenya.